Thank you very much, everyone, for joining today. I really appreciate it. And I hope you've all had a very nice Christmas. And I wish you a very happy 2021. It's got to be better than 2020. I know that there might be certain questions that come up because we're going to have a massive geek out now. Hormonal production, hormonal health, about causes of hair loss and some of the new treatments. If you do have any questions that pop up during the course of this talk, please pop them in the chat box and we'll try to get through them at the end of the presentation. So this is going to be rapid whistle stop tour of all of the topics that we talked about in our invitation. There's going to be about 3 or 4 major sort of subheadings in this talk. So before we dive in to testosterone, I just want to introduce you all to the Lovely Clinic and the team Lovely Clinic. So that's me, Dr. Kishan, on the end. Sarah's next to me. She's the one who opened the clinic in 2013. We've got Dr. Ewan in the middle, and in blue we've got our lovely Dr. Samira. So we all share the same ethos of enhancing healthy good looks in our patients, but very much keeping their well-being as the foremost consideration with everything that we do throughout the patient journey. As a group, we really love what we do on it because on a daily basis, we're blending art, anatomy, medicine, all of the above packaged up in our TLC sort of approach. And for the last 10 years or so, each of us was heavily involved with skin optimization and skin improvement, anti-aging for the skin, and that's still very much that's a major part of our practice. But we found that adding bioidentical hormones, vaginal rejuvenation, and of course the hair treatments that we're going to talk about, has really complemented our aesthetic medical practice. And it's done it in the most organic and holistic way. And this is almost an inside-outside approach. And it takes quite a lot of learning, a lot of skill, constantly updating ourselves, and there's a lot of art to it as well. But that's what really makes the work so interesting and keeps us passionate about it. And whether you talk to any of the doctors or whether you talk to any of our wonderful support team, you're going to get the same level of commitment and dedication, whoever you speak to. And these guys, Danny, Ross, and Larissa, they're here 7 days a week to help you with any questions that you might have. Okay, so that's enough of the introductions. Let's dive right in to the topic of testosterone. Now, testosterone is classically referred to as the male hormone, but it's actually a sex hormone that's vital for both men and women. It's vital for growth, development, well-being. Basically, a signal from the brain, the hypothalamus, sends another signal from the pituitary gland, which is slightly lower down, and that sends another message to the gonads to produce testosterone. In young boys, it stimulates virilization and puberty and masculinization in men. And it brings about certain changes in women as well. Testosterone is derived from cholesterol. It forms the backbone of most of the sex hormones, in fact. In men, testosterone is made from the testes. Pretty much most of testosterone is made in the testicles, and then a small amount is made in the adrenal glands. In women, it's slightly different proportion. Half of testosterone in women is made in the fat and the skin, and a quarter is made from the ovaries, and another quarter is made from the adrenal gland. Women need testosterone very, very much as well, just as much as men, but they produce about 1/10 to 1/20 of the amount that men produce. So just to introduce and unpack the topic of testosterone deficiency, we're going to meet one of our patients, James. Now, he's a chartered surveyor in his 50s. And his principal complaint was actually that he was not enjoying his sex life anymore. He'd lost confidence with lovemaking, he had some degree of erectile dysfunction, and he just didn't have stamina for sex anymore. Additionally, he was also having some issues with motivation. His family was commenting on his mood, that he was quite irritable and just a grumpy fellow. He reported, and he showed me pictures, that his physique had changed. He had quite a sort of a lean, fit figure before, and now he'd put on more fat in the midsection. As well as loss of sexual stamina, he had less performance in the gym. He couldn't really go running for as far as before, and he was much more cautious about risk taking, and his ambition had changed as well. So we did a comprehensive consultation with James. We sent off samples of blood, urine, and saliva for a really complete, comprehensive assessment of his hormonal balance, or imbalance as it turned out to be. Now, testosterone is a really important hormone for men. basically it improves mental function or cognitive function and mood. It maintains heart health and it prevents osteoporosis. It's vital for sexual function, erections and libido. And it's also important for behavior, for drive and for competitive edge. It's also very important for body composition and for fitness levels. And it supports a healthy metabolism. And it also, interestingly, supports, it stimulates the production of red blood cells. So it prevents anemia as well. So if testosterone has all these beneficial effects, the negative is often true when people have a testosterone deficiency. Now, James already described a lot of these symptoms, such as a lack of enjoyment of sex, a lack of libido and erectile dysfunction. But some of my patients who come in with testosterone deficiency also complain of a lack of energy, depression almost as well. And also later down the line, testosterone deficiency has an impact on blood sugar control. And there is an increase in the risk of diabetes if there is a defined testosterone deficiency. Additionally to that, James did mention that he was feeling a little bit grumpy and he'd lost his stamina for fitness, for work performance. And in some men, lack of testosterone also impacts on sleep as well, which sleep is very important for health in general. So when a male patient comes to my clinic and he's got a testosterone deficiency, there are certain telltale signs which make it easier to diagnose the issue further. So often there will be a loss of hair on the body, particularly on the calves, sometimes on the chest, and sometimes there'll be a patchy beard growth as well, or thinning of the beard hair growth. There can be a decrease in lean muscular mass and an increase in fat in the abdomen or around the chest area. The skin changes as well. Testosterone is actually very important for keeping the skin healthy and thick and wrinkle-free, actually. So one of the signs of testosterone deficiency in men is drier skin, dry eyes, and actually the beginning of wrinkles. Genital health doesn't escape either. The skin of the penis can become paler, more wrinkled, and actually it starts to shrink as well. So genital health is impacted on by testosterone deficiency. Very, very important for long-term health, testosterone actually maintains and strengthens bones. So when you have a deficiency, you can see a lack of bone mineralization or a decrease in bone density. Now, as we live longer and longer, you find that there are increasing rates of osteopenia, which is an osteoporosis, which is basically like brittle bone disease, and it leads to men becoming more and more frail as we get older. Additionally, low testosterone is also low testosterone is also inversely related to blood pressure and cholesterol, which means that as testosterone drops, it's noticed that in population studies, cholesterol and blood pressure rise. So this is a little bit of a silly side, but it's just really to illustrate what could happen to the perfect male physique if testosterone levels become too low. You know, I said it was silly, but it's interesting that some of the testosterone deficiency that we see, it can start very early in some men, even in their 20s. So this isn't a completely silly slide. And sometimes if it's very severe, we need to involve the care of a specialist endocrinologist just to help, especially the younger men. So this is just another slide, just really revisiting all the signs of testosterone deficiency. So these are the things that we would see, or things we would see in the blood results for patients who come in with these symptoms and signs. Testosterone deficiency also correlates with a lot of the things that we associate with aging. And if we look at observation studies, these are research studies which look at populations and basically differences among them. What's been noticed is that male populations who have higher levels of testosterone have lower levels of disease, and they have increased lifespan as well. And the reverse has been noticed as well. So if you have a lower testosterone in general in that population, there seems to be a higher rate of disease and a shorter lifespan. And as we said, sometimes this testosterone decline can happen quite early, even in the 20s and 30s. From the age 25 to 75, there's a 30% decrease in total testosterone. And that has a huge impact on health long term. Now, testosterone is actually 3 hormones in one. So it's testosterone. It also converts to many other different types of hormones as well. One of them is estrogen, and the other one is dihydrotestosterone. We're going to come to that later on because that's very, very important as a cause of hair loss. One way that testosterone seems to be lost as we get older is, first of all, naturally levels decline as we get older. So production of testosterone from the testicles decline, but also there are some men where there is a much higher conversion of testosterone to estrogen, and estrogen has a secondary effect of driving up a carrier protein called sex hormone binding globulin. And we'll call that SHBG, and it's very, very important when we talk about women later on. But SHBG is basically like a carrier protein. It transports testosterone from one part of the body to another. In fact, it transports all of the sex hormones, but it seems to bind on to testosterone much, much more strongly, much more rapidly. So those men who naturally convert testosterone to estrogen more, they will also have much higher levels of testosterone around. And this carrier protein blocks testosterone from having its actual beneficial effects on the tissues that it's supposed to work on. It almost binds it up and prevents it from doing its job. A very sort of slightly worrying study that's been done in recent years has shown that the level of testosterone for 60-year-old men or men of all ages is actually declining. And now that's independent of all other normal aging or health or lifestyle factors. So they've shown that from 1987 to 2004, there's been a 17% average drop in the level of testosterone. So that's quite a huge thing to say. Now, it's worrying, and we can have a guess at some of the causes. So some of the causes that have been postulated are that we live in a toxic soup. We're surrounded by chemicals in our packaging and plastics. Entities such as phthalates or plasticizers behave like environmental estrogens, and they block testosterone from working. And of course, they stimulate and drive up those levels of that carrier protein, SHBG, as well. We have other toxins in crop insecticides, in non-organic food, and even there's been studies to show that in prenatal life, as a male baby is sort of developing in the womb, if the mother has either paracetamol or ibuprofen, that has a negative impact on testicular health and subsequent testosterone levels later on in life. Now the next slide, yes, this next slide is a little bit alarmist. I don't know who's not seen The Handmaid's Tale. It's a fantastic series. The Handmaid's Tale is a story of a dystopian alternative reality, which is really triggered by a global infertility crisis. Now, infertility is an important topic in itself, but yes, it's related to testosterone production because 30% of all infertility cases of couples, 30% of those cases, the issue lies with the male partner. So really, low testosterone production goes really hand in hand with lowered sperm count and concentration and quality. So a really important study in 2011 found that there had been, over the last sort of 30 years, there's been a 52% decline in sperm concentration and a 59% decline in total sperm count. And that's a huge study of nearly 50,000 men. I mean, this is all very doom and gloom, and what are we going to do? I mean, we have to do something to try to optimize our testosterone levels, and we're going to come to some of the pharmaceutical options later, but integrative medicine is all about looking at some of the natural ways alongside some of the lifestyle ways that we can use to optimize our testosterone levels. So top of my list is actually lifestyle factors, and it's been shown in repeated studies that resistance training or HIIT, high interval intensity training, has improved testosterone levels as well as muscular bulk, of course, as well. In lifestyle, we can increase more sex. If we have more sex, so that improves testosterone levels, as does optimizing sleep. And obviously wearing loose boxers is very important as well, because if you wear tight underwear, that increases the testicular temperature, which reduces the cellular activity in the cells responsible for testosterone and sperm production. Now, stress deserves its own category even though it's a lifestyle factor, because stress has an impact across all disease and life in general, and stress tends to worsen all outcomes. So it's really, really important, because it impacts on everything, to identify any stresses in life and try to reduce the impact of stress on on your health. We're going to touch on mechanisms for doing that later on, but stress is a really biggie when it comes to optimizing testosterone. There are medications to consider when we're trying to optimize testosterone. For example, there's certain antidepressants such as SSRIs, there's selective serotonin reuptake inhibitors, which actually have an impact on sexual drive and libido, as do opioid pain medications like cocodamol or tramadol. They also have an effect on testosterone levels as well. So it's worth sort of, you know, in our consultations, we have a very, very in-depth look at your medical history as well. And in younger patients, we do consider other alternatives to testosterone supplementation. We might consider a fertility medication called clomiphene, or sometimes another hormone, a male hormone called DHEA, which is dehydroepiandrosterone, to stimulate some of those male hormone receptors in a younger man, because that has the beneficial effects, but without affecting fertility. So another, just a point to mention that I generally give testosterone replacement for patients who have deficiency when they're older, when they're sort of 40s, late 40s or 50s, but I don't necessarily use that for younger patients. To optimize testosterone, there's obviously things to avoid. Alcohol, caffeine, smoking, and refined sugars have all been implicated as causes of reducing testosterone. And there's things obviously we want to improve, like our diet. We always advocate that our patients see a nutritionist. We work very closely with a nutritionist who is also trained in functional medicine. And she generally recommends a plant-based diet with plenty of fruit and vegetables, including healthy fats, because we need cholesterol to build hormones as well. And also, we want to include some healthy organic animal protein or vegetable protein. We want to cut down refined sugars, hydrogenated oils, certainly trans fats, and we want to minimize any artificial colors, preservatives, or sweeteners such as sucralose or aspartame. Testosterone production is also really depends on optimizing vitamin levels, particularly of zinc, vitamin D, and vitamin A. These are really crucial. I mean, zinc, for example, is involved in literally hundreds of pathways affecting reproductive health, not just testosterone production, but obviously sperm production as well. And we mentioned some of the causes why we think testosterone levels are going down, you know, decade by decade. So we want to be aware of, we want to watch out for endocrine disruptors. We want to think about maybe swapping out some of the plastic in our life. Maybe avoiding certain non-organic food, particularly the dirty dozen. We might want to swap certain fruits and vegetables for organic versions so that we minimize the environmental effects on our testosterone levels. And then finally, we come to herbal or supplemental things that we can think about to naturally stimulate testosterone production. There have been quite a few proposed. There's some literature, there's some research to show that these are effective, but there needs to be a lot more research carried out, and a lot more elegant, larger powered studies need to be carried out before we can really guarantee that they are going to have such a beneficial effect on testosterone levels. So some of the most popular ones include Tribulus terrestris, which is an Ayurvedic, which is known in Ayurvedic medicine, and that's supposed to stimulate testosterone production naturally. There's Tongkat Ali, which is sourced from Indonesia, and that actually knocks testosterone off the carrier protein. We talked about SHBG before, that particular protein that binds onto testosterone. Well, Tongkat Ali actually separates them, so then you have much more bioavailable testosterone to do its magic on the body. And then I love the name of this. This has got some debate about how effective this is, but horny goatweed, I mean, what a fantastic name for a testosterone booster. And there's plenty of other things that we include for herbal or natural mechanisms of improving testosterone, particularly in younger men. It seems to work a little bit better. And we've sourced a very good pharmaceutical grade combination of the most effective natural testosterone support herbs and supplements. So it's definitely an option I try, as I said, particularly with younger patients, for about 3 to 4 months, and then I will reassess with blood, urine, and saliva investigations. And then we talked about natural versions of boosting testosterone, and then you may well be aware of synthetic testosterone equivalents. Now, these are definitely not the same as the testosterone that's produced in the testicles or in the ovaries in women, but it's sold as a form of testosterone, and certainly it's promoted as muscle enhancing and bodybuilding. But my question is, at what cost? Because synthetic testosterone products, unfortunately, they have different chemical moieties added onto the core hormonal component of them. And that extra bit on the molecule, unfortunately, means that it has to be metabolized extensively through the liver, and the liver has to do a very, very hard job of clearing it from the system. And that in itself raises inflammatory proteins, and it can dangerously raise levels of cholesterol as well. And interestingly, once you've been using synthetic testosterone products for a long time, it tends to suppress the natural production of testosterone that we have already inside us. When it comes to synthetic testosterone, I just say, think of it like a drug, just say no. Which brings me to bioidentical testosterone. Now, this is completely different. This is plant-sourced, chemically identical to the testosterone that we produce in our own bodies. Molecule for molecule, it's exactly the same. And there are indeed pharmaceutical options. So these are things that you could get off the shelf from Boots. You'd need a prescription, of course. But there are options that are made by the big pharmaceutical companies. They tend not to be appropriate for everyone because of the other ingredients that go in them. So we also use other options as well. So we have compounded versions. So we work very closely with a specialist pharmacy to produce creams or gels which are rapidly absorbed by the skin, and they deliver tailor-made doses of testosterone for our patients once we've done our testing. In America, there's a real fashion, there's a real strong practice of providing not just topical creams and gels, but also injections and pellets. Now, injectable testosterone and testosterone pellets are quite similar in that they're given at, maybe at 3 or 6 monthly intervals. Injections are done much more frequently, sorry. They're done at maybe weekly to 2 monthly intervals, anywhere between then. But the problem I have with these particular forms of testosterone delivery is that when they're put in initially, you get a lovely big surge in testosterone. And then for the rest of the time that they're supposed to be active, levels can become suboptimal to the point where they're not actually doing enough for the patient. So I prefer in my patients to give them a bioidentical testosterone cream, which they apply daily to their skin at different sites on the body. And that gives a physiological boost of testosterone every morning. Now, in a normal healthy male and a healthy female, the bulk of testosterone is produced in the morning on waking, and then it sort of gradually goes down throughout the day. And that's what we're trying to replicate with a bioidentical testosterone cream. So that, I suppose, is my favorite way of delivering testosterone. There has been a lot of controversy about testosterone in the past, and there have been some really poor studies, poorly designed and low power. I mean, one study in the past was based on the findings of one patient, and some other studies were based on very poor science and poor records. But the overwhelming research, the overwhelming findings of all the recent studies have shown that testosterone itself has huge impact and huge beneficial influence on our health, on blood pressure, on heart disease, on vascular flow, on well-being, on bone health. So I'm very confident that for most, if not all of my patients, testosterone is a very, very helpful treatment to consider. This is one page of the testing that we would have done for James, and it's definitely not a page to, it's very busy, it's definitely not a page to memorize, but this is actually only one of the pages that we have to analyze before we have a secondary consultation with you. And it's an important stage of treatment at our clinic, that we see you for consultation first, and then we spend about at least an hour going through these extensive list of results, because we check your blood, we check your saliva, and we check your urine as well, to make sure we've got the most comprehensive picture of your hormones. And we check your thyroid gland, we check cortisol from the adrenal glands, as well as melatonin and a bunch of other things, which really gives us not just hormonal health, but it gives us a comprehensive picture of general health as well. So yes, so I don't know if we've probably forgotten about James by now, but James is the chartered surveyor in his 50s who came to us. Really, his principal problem was not enjoying sex anymore and erectile dysfunction, as well as some other secondary mood problems as well. So we saw him for a review appointment with his results. We did diagnose that he had suboptimal testosterone levels. And yeah, I'm sure you've guessed, you know, my favorite is to restore testosterone in a man of this age with bioidentical testosterone cream. And he would apply that twice a day. And he did that for 4 months, which is basically matching what he needed in terms of his physiological needs for testosterone. And he did that twice a day for 4 months, as we said, and then we saw him for another review. In that time, he said that his sex drive had returned, his enjoyment had returned, and stamina, and also not just stamina in the bedroom, but also his interest in exercise. His stamina for running had come back, and his body had started to change as well. So his body fat percentage he was measuring in the gym, that had started to gradually come down as well. And the biggest change physically was that he'd noticed his abdomen has started to shrink as well, and his pectoral fat as well. Over and above everything else, though, he said that the combination of all these things meant that his mood had really, really improved, and it was noticeable from his family and his wife. Everything, you know, there were many, many positive things to feed back. In fact, he just said that life is really fun again. So that was one success story with James, and you know, you'd be thinking, you know, testosterone is very, very important for women. It's very, very important for women as well. And that brings me on to Angela. Now, Angela is a very successful woman. She's a director of her own company. And again, she came to us with the interesting, and it's interesting that it's similar to the previous patient. Her main complaint was that she was having no sex drive at all. And she couldn't remember if she'd ever actually had an orgasm. She still found her partner attractive. She just didn't want to have sex anymore. And she wasn't actually having any arousal down below either. So that was her main symptoms, but she had some other symptoms as well. And they were that when it came to making big decisions, she was quite unsure of what was happening, unsure of what to decide. And I'm just going to mention that she had been on the pill, the contraceptive pill, for many years. From her teens until her 30s. And I'm going to touch on that later because it's an important thing when it comes to testosterone deficiency in women. Okay, so just like James, we did a full panel of testing, blood, urine and saliva to get a really comprehensive picture of her hormonal levels and her metabolism. So her main problem was not enjoying sex anymore and not having any arousal or any drive. And female sexual function is much more complicated than in men. In men, there's sort of a race to the top, and then sex happens, and then there's orgasm, and then there's a sort of a refractory period where men don't want to have sex again until the cycle starts again. Women are much more complicated, and there's a circular sort of a cyclical nature to the sex drive, and it's much more common than just a lack of testosterone. There's a lot more emotional factors at play, and situational factors. But nevertheless, sexual dysfunction in females is reported as high as 40% in premenopausal women, and it goes up to almost 80% after menopause. So it's a huge problem in terms of well-being. And sexual dysfunction in women definitely can be caused, at least in part, by low testosterone, because testosterone is really important for lubrication, for vaginal blood flow and arousal. And also testosterone is linked to confidence and body confidence because it promotes lean body mass. And interestingly, most people don't realize that testosterone's got a huge role in preventing wrinkles as well. So these were important things just to consider when we talk about the natural decline of testosterone. And as you see, you know, some of the more common symptoms of deficiency are listed there in the pink box. And in women, testosterone seems to decline a lot earlier than in men, and it can start sort of in the early 20s, and it gets depleted much more rapidly in the until the mid 30s, and then it plateaus until it declines even slightly further after menopause as well. women who have a hysterectomy involving the ovaries, or actually just any type of hysterectomy, can have significantly reduced, almost, you know, cliff-hanging sort of drop in their testosterone levels. So they are often the women that come to us with severe problems with their sexual arousal and drive. And I did talk about Angela being on the contraceptive pill. Now, do you remember we talked about SHBG, which is that sex hormone binding globulin? Now, the oral contraceptive pill is essentially a synthetic estrogen. It's extremely powerful, and it stimulates a big rise in levels of SHBG. SHBG, you can think of it like a bus. It's sort of ferrying school kids from one school to the next where they're going to play football or do something in that other school. And as with anything in life, when you have too much of something, things can become bad. So if you've got too many buses, you'll have then no children roaming around, you know, you'll have no children available to roam around and play football because they'll all be sitting on the bus. In the same way, when a woman takes a contraceptive pill, it drives up SHBG so high that often all of their testosterone is bound up very, very tightly, and it's not then available to have its beneficial effects on the body. And the very alarming thing is that once a woman has been on the contraceptive pill, it can actually raise the SHBG levels permanently. So that woman will therefore have a consequent permanent functional testosterone deficiency for the rest of her life because she's been on this tablet. Now, nothing is black and white in life, and there has been numerous studies to show that if you take the contraceptive pill for 1 to 3 years while being a young woman, it has good effects to prevent ovarian and uterine cancer. So these, like I say, it goes to show you that nothing's all black and white. So for Angela, we did this extensive analysis again. It applies to women as well. It's actually slightly more complicated when it comes to women when we do our hormonal testing. And when we book always at least an hour's session over Zoom or in better times face-to-face to go through the results and the findings. So yes, with Angela, we did also find that she had suboptimal testosterone levels. She had very low bioavailable testosterone, which means that, and she had quite high levels of SHBG, which wasn't surprising. And I'm sure you've guessed what I did. I restored her testosterone levels with a bioidentical testosterone cream, which she applied vaginally once a day in the morning. And she did that for 4 months before we reviewed her again in clinic. And she actually turned around to us and said that she was enjoying her sex life again. Just like James, she was feeling more alive. She was feeling happier in her relationship. And she was also feeling much more sociable as well. And her mood was much more improved as well. So we talked about Angela's sort of benefits of testosterone in terms of well-being, but bioidentical testosterone has long-term effects on general health, particularly for vaginal health. If we just talk about what happens with age is that the vaginal tissues start to shrink, they atrophy, and there can be additional problems with urinary incontinence. So testosterone prevents that. There's been numerous studies to show that it maintains vaginal health. And it prevents the mucosal health as well. So it doesn't become so fragile as time passes. Testosterone in women also prevents coronary heart disease. There's many mechanisms for how it prevents the furring up of arteries in the around the heart. And also testosterone has a very important role when added to bioidentical estrogen. So when I have a menopausal female patient, I'll often give them back estrogen and progesterone. When I add testosterone back as well, it has a much more bone enhancing and strengthening effect on the body as well. So as you can see, testosterone has huge implications in terms of well-being, in terms of long-term health, and of course on longevity as well, because heart disease and osteoporosis are basically big reasons for female mortality. So, okay, so we had a slide at the beginning where we met one of our doctors, and I'll just see if you recognize this lady. Guess who? Who could this be? So this is actually Dr. Sarah who started the clinic, and me and Sarah have had our own journey with hormonal health and health in general. And just this picture will show you that before we started some hormonal therapy for Sarah, there were some big issues with mood, with difficulty losing weight, and you can see that she looks absolutely stunning now. And we're going to come back to, hopefully Sarah's around today, and we're going to have a bit of a chat later on about what her experience has been. We've actually been sort of trailing around the world, going to conferences, basically fangirling all the world authorities in hormonal restoration. And we've sort of developed our own way of doing things at the lovely clinic. So we'll hopefully have a chat to Sarah about that later. Now, one of the questions that we got sort of before we started just after we advertised was that, why would we want to optimize testosterone if testosterone sometimes causes problems with hair loss? Now, that's a very valid question. And yes, it's true. As before, nothing is black or white. Too much of anything can be bad. And certainly testosterone has a major role in hormonal hair loss. But before we jump into that, let's actually start a little bit of a 101 about hair itself. So this is sort of hair 101. Hair strands are made of a protein called keratin. Most of the hair is actually dead, except for the base of the hair, which is called the bulb, and that contains rapidly dividing cells, which then cause the hair strand to grow. Now, chemotherapy interestingly kills those rapidly dividing cells in a cancer, but also it kills those rapidly dividing cells at the base of a hair, and that's unfortunately why there's massive hair loss once chemotherapy treatment started. The hair is like a mini organ. It's surrounded by glands and little muscles that make it stand up on end. And the average person has about 100,000 hair follicles on the scalp and another 50,000 on the body. And as we grow, from children to adults, the scalp enlarges, and then so that's why sometimes we might think that our lovely luscious hair that we had as a child is not quite so luscious because of the growth in the scalp. The hair itself can be in a visible form, which is what we see on our head, and it can also be in a very fine, baby-like, fluffy-like form as well, called vellus hair. And the hair can transition from that visible hair to invisible hair, dependent on certain triggers, like androgens, which are the male hormones. When the hair grows through cycles as well, and in the growth phase, it's growing about a centimeter a month. So as long as the hair is in the growth phase, it's growing about 12 centimeters a year. So the hair does, as I said, the hair grows in cycles, and the first cycle is the growth phase, which is known as anagen. And then we've got rapidly dividing cells at the base of at the bulb of the hair. And then at some predetermined time, after 2 to 6 years, the brakes come on. There's nothing happening anymore in terms of the cell division at the base of the hair, and the hair moves away from the blood supply. So the brakes are on, and then gradually the hair, after a few weeks, the hair goes into the resting phase. It doesn't get completely shed. It just stays passively in the follicle. And then if you tug on it, the hair is actually released without any pain, or it sheds when you're sort of rubbing your scalp. There are certain things that keep the hair growing and keep it healthy in the anagen phase and the growth phase. And these are growth factors like IGF-1 or insulin-like growth factor 1 or prostaglandin E2. Now these are growth factors which are very important. I'm going to touch on them later when we talk about PRP. But they promote anagen or the growth phase. There's other things, conversely, which put the hair into the resting phase or the shedding phase. And these are things like inflammation, which produces chemical messengers known as cytokines, or cortisol, which is released in response to stress. And these promote cell death in the hair bulb and the shift of the hair into telogen. And there's plenty of other things that actually have this kind of effect on the hair, such as during breastfeeding, there's higher levels of this hormone called prolactin, which inhibits hair growth as well. And prolactin may be raised for other reasons as well, which has a knock-on effect on hair growth and hair fall. Interestingly, globally, black hair is the most common and red hair is the most rare. So now we come on to hair loss. Now, this is quite an important topic, just anecdotally from our patients, because Although we lose about 100 hairs a day, more excessive hair loss more than that can be defined as alopecia or hair loss, and that can have quite a large psychological impact on our patients. Now, I have listed the top causes of hair loss here, but this is by no means exhaustive. I mean, there have been books and books and books written on trichology. We're really going to focus on the top three, which are hormonal hair loss, effluvium, and autoimmune. There are, as I said, many other reasons, such as psychiatric related disorders like trichotillomania or tinea capitis, which is a fungal infection, but we're going to focus on these top three. Okay, so let's start with hormonal hair loss. Now, I don't know if you can see, but there's the typical male pattern hair loss, which starts in the anterior arches, and then it continues onto the crown, and then the focal areas of hair loss join up until the male patient becomes completely bald. And at that stage, it's very, very difficult to reverse hair loss. In women, hormonal hair loss proceeds in a slightly different way, where the scalp on the hair on the scalp becomes thinner and thinner and thinner until you can actually see the scalp visibly as you look at it. And in both cases, there is an elevated level of the male hormones known as androgens, but particularly dihydrotestosterone, which we're going to refer to as DHT. Now, DHT is produced from testosterone, and it's converted from testosterone by a special enzyme called 5-alpha reductase. Over time, if you have excessive levels of DHT, this causes miniaturization of the visible hair into the invisible hair. And even if time continues, the hair can stop growing altogether, and then it's almost impossible to reverse the hair loss that we see. Now, there's many factors which impact on hormonal hair loss, and these can include things like genetics, stress levels, and overly sensitive androgen or testosterone receptors on the scalp. In women, it's just in women and men actually, there are certain things to consider where any hormonal shift, such as puberty, starting the contraceptive pill, starting HRT even, pregnancy, breastfeeding, menopause, any hormonal shift can all cause transient loss of hair. So that's just something to remember. And often that hair will reverse, that hair loss will completely reverse once the hormonal levels settle down. And one thing I've definitely noticed is that if I have a female patient who's in menopause or perimenopause, who's experiencing hair loss, I get much better results when we use a whole body approach and do full hormonal testing and replenish hormones systemically rather than just on the scalp. So when we do that, we have to do testing with urine and blood and saliva like we did for Angela and James. And the advantage of that is it does look at stress-induced hair loss as well, because we can see from our testing whether you have excessive levels of cortisol or excessive levels of DHT through this particular enzyme 5-alpha reductase. As you can see here, this particular patient doesn't have very high levels of this enzyme, so they're unlikely to need some of the medications that we would prescribe for hormonal hair loss. The other name for hormonal hair loss is androgenetic alopecia, and you can see that interplay better here, where you can see she doesn't have very high levels or high activity of 5-alpha reductase. Okay. So another very common form of hair loss is known as effluvium. Now, this isn't where you get patches or even like sort of a density of hair loss. This is kind of all over hair loss. You lose hair like a dog. You know, you will lose hair on the pillow, in the shower, on your brush. And the interesting thing about this one is that it usually happens 2 to 6 months after some identified or unidentified trigger or massive change in situation. And effluvium has many, many causes. So it could be stress, mental, emotional, physical, any stress on the body at all. And it basically gives a signal to the body that we need to divert all of our resources to somewhere else in the body to handle this stress. Now, healthy hair growth, unfortunately, isn't a priority when the body is going through this type of stress. And therefore it takes a back seat and the hair abruptly will go into the resting phase, and then again 3 to 6 months later it will go into the shedding phase, and that's when people experience this global, very, very diffuse hair loss. Additional, as well as stress, there can be any abrupt change in situations, such as an abrupt change in diet. So there's been patients who've basically become vegan overnight. They've just changed their diet so abruptly that it's put their body into sort of a fight or flight situation, or a massive stress situation, or they've gone the other way. They've gone from being vegan to being paleo or something, and that's had a knock-on effect on their hair growth. And also drugs, not just chemotherapy, drugs such as antifungals, the contraceptive pill, antidepressants, some of the anti-acne drugs also can cause this type of diffuse hair loss known as effluvium. And as we said, any major stress or systemic illness on the body puts big demands on the health of the scalp, and therefore it's just important to try to identify it. And we can also do that with our tests at the clinic as well. Similarly, scalp health is fundamental for healthy hair growth, because the hair is actually an appendage of the scalp, of the skin of the scalp. So if you have poor blood flow, if you have poor blood flow, or if you have some sort of trauma to the scalp, sunburn, for example, or even any other skin diseases like fungal infections, this can also affect the hair growth on the scalp. But reassuringly, once we've identified the skin problem, treatment of the skin usually reverses this hair loss in its entirety. And now this brings me to another important, the third sort of hair loss mechanism we talked about, the type of hair loss, which is known as alopecia areata. Now, often I see this in younger men, actually. It's a type of autoimmune hair loss. As such, it can be seen when a person has another autoimmune disease like celiac disease or ulcerative colitis or thyroid autoimmune disease or diabetes. And just because you have those conditions, however, it doesn't mean that you're guaranteed to get this type of hair loss, but it does raise your risk for it happening a little bit more. But like any autoimmune disease, alopecia areata is multifactorial. And in fact, what I've seen sometimes is that there's often some major trauma, like bullying or parents divorcing or a car accident, which triggers this type of autoimmune hair loss as well. The good thing is that although it can be quite alarming and quite distressing for patients, it usually reverses by itself. And it's usually the fact that that initial trigger is gone as well, a little bit like effluvium. And the Alopecia Areata Society states that there's about 147 million people in the world, worldwide, who've experienced this type of hair loss. And just, this is a side point, really, it's less common, but we see it, this type of hair loss, particularly in the temples and in the anterior part of the scalp, when people are wearing very, very tight hairstyles. Yes, it's much more common in Afro-Caribbean women, but it's also very common in ballet dancers or dancers in general who wear very tight ponytail or tight buns. And just basic sensible advice about hairstyles can actually reverse this type of hair loss as well. So yeah, so that we've talked about hair loss. Now we should start thinking about how we're going to treat this. And this is the second half of our talk that we're already on. So stress is a huge cause of hair loss, and it seems to worsen all of the other types of hair loss. Even hormonal hair loss seems to be negatively impacted by high stress levels. Oh, by the way, that's just to mention that you can have more than one type of hair loss at any one time. It doesn't mean that just because you have alopecia areata, for example, you might not have hormonal hair loss as well. The two can definitely coexist, as can effluvium as well. What sensible measures to take first is that we look at sort of nutritional status, whether there's any vitamin deficiencies, thyroid health. I definitely recommend that we check for hormonal balance. And then we start looking at some of your lifestyle factors as well. So are we using very acidic shampoos? Are we using regular perms or chemical treatments that are impacting on the health of the scalp? As we mentioned before, particularly for traction alopecia, we want to avoid those very tight hairstyles. Once we've done all this, we can start thinking about some active treatment. And if the patient wants to engage with pharmaceutical treatments, we've got the first line therapies would be things like minoxidil, or dutasteride or finasteride, which are shown here, in their brand names, Propecia and Rogaine, which are very well known, and they've got a very long history of use behind them. They do have their own side effects, but we're gonna touch on those in a moment. I think important on this side, just to mention that we should really identify the cause, and then we can have a much more success in terms of advising patients about hair loss. So I've got many different options when it comes to pharmaceutical options for hair loss. And the top two really are minoxidil and dutasteride. And then often I combine that with a hormonal assessment and hormonal optimization, and definitely thyroid, because a low functioning thyroid and an overactive thyroid can actually cause its own type of hair loss as well. But there's another ingredient which is called latanoprost, or another form of bimatoprost, which are very exciting because they have incidentally been found to cause increased hair loss in the eyelashes, and it's being used in topical formulas for the scalp as well. And these are usually my favorite topical pharmaceutical treatments that I'll try in my patients, and sometimes I'll give a tablet or some vitamin support as well. But there are supportive things that I will include in a formula as well, such as melatonin, caffeine, or retinoic acid. We talked about the pharmaceutical options, but as ever, this is, we run a sort of very integrative clinic, inside out approach, and a natural approach is often very, very preferable for some of our patients. So stress we talked about before in terms of testosterone as well, and we're going to talk about it here because stress has a huge impact on hair loss, and sometimes it can be not just the trigger, but it can be the thing that makes you continue having hair loss. Stress management is really key, and there's so many different ways to manage stress, so we can sort of investigate all these different things and find the one that works for us. And it might be one, it might be two, but it could be yoga, it could be breath work, it could be even counseling or CBT. There's an app made by a company called HeartMath that's got fantastic research which identifies a style of breathing and mental thinking which is like meditation, but it optimizes your breath and your stress levels. Optimizing sleep is huge, as is relaxation. And then we can always think about calming herbs as well, or adaptogenic herbs to help support that as well. Lifestyle is important, healthy exercise levels, yoga, there's some inversion poses in yoga, or those inversion tables, which obviously enhance the flow of blood to the scalp. And stopping smoking is essential, because smoking is, every puff of a cigarette contains hundreds, if not thousands, of toxins, and they have their own impact on healthy hormonal levels and metabolism on the scalp as well, and blood flow, of course. Nutrition is key. We must sort of optimize our vitamins, our antioxidants, and there's been several studies to show that poor diabetic control has an impact on hormonal hair loss as well. So maintaining a good nutrition, sort of minimizing refined sugars, is really important. And there's many alternative therapies which have been cited in the literature to help with hair loss. And because there's so many different types of hair loss, it's very hard to know which therapy is the most beneficial. So sometimes it's a case of trying which one might benefit you if hair loss is your issue. So things like acupuncture, scalp massage, of course, and lymphatic stimulation will increase blood flow to the scalp, which is beneficial, as of course gentle brushing and hot and cold water therapy on the scalp will improve blood flow as well. For those of you who like nice smelling oils and things to stimulate the scalp further, again, in the literature, there's been studies to show that rosemary and peppermint oil, castor oil doesn't smell so nice, but these all have been cited to show some benefit in reversing hair loss. Very importantly, it's important not to have them in plastic bottles. Now, the reason for this is that you get, in plastic bottles, you get leaching out of the phthalates, the endocrine disruptors that we talked about before, into the oil. And then if you apply them, you're undoing all the good work that you've done with the rosemary or the peppermint oil. There's also several herbal supplements, such as saw palmetto, reishi mushroom, amongst others, which have been cited in the literature. There's some debate about how effective they are, but often, as an additional thing, I will recommend them for patients to try. And my patient might trial them for about 6 months to a year, just to see if there's any improvement. In addition to these, there's many oral supplements and topicals that have been debated whether they're any benefit for hair loss. The problem is that the studies are not very reassuring, because they're not very large, and they haven't been repeated over and over to show a reliable reliance on these treatments for hair loss. So we've talked through a few options, but what's the future of hair loss and what's really our aims for what we're trying to do? And the main thing is we want to arrest any further hair loss. We want to try to regenerate any sleeping hair follicles that are there that have the capacity to regenerate. We want to stimulate them. And many of our patients do opt for hair transplants, and they'll arrange surgery and they'll have the hair transplant procedure. But the problem is that the longevity of the procedure is really unpredictable. And the reason for this is that there's a reason, there's an underlying reason why the hair has been lost in the first place. If you then do a hair transplant after that, the cause hasn't necessarily been addressed. So therefore, an aim of our hair loss treatment is to support people who are undergoing transplant as well. So it really is time for a change in thinking. And now we have to start thinking about what is our gold standard for hair loss treatments. And I think that brings me on to our new approach, which is providing personalized precision medicine. Now, in summary, this is another form of testing which we use for our hair loss patients in our consultation to give targeted therapies for you and your individual situation. Because what I would do before is I would look at my patient, try and diagnose the type of hair loss they have, put my finger in the air and say, I've got my favorite remedies, my favorite pharmaceutical options, sometimes my favorite vitamins, and then I will recommend them to my patient. The problem is that studies that have supported me using these ingredients and pharmaceutical treatments, they have their own limitations. And what's been found is that even the top first-line therapies, not everyone responds to them. Only up to 60% of people, for example, respond favorably to minoxidil or finasteride. So there's something missing here. And that's really where we come in now with our new genetic test, which is called Tricho test. And what that does, it looks at the 1% looks at the very small section of DNA, which is related to hair loss and all of the factors that contribute to your particular type of hair loss. And that identifies a unique tailor-made treatment plan to match your individual makeup. And this is really the basis of what we're doing with Tricho test. So there are partners in Barcelona. And what we do is we have a swab which we wipe the inside of your mouth with, and that gets sent to Barcelona. And a few weeks later, we have a personalized way of looking at your particular hair loss situation and how we might recommend specific treatments to help further. So this is just a slide to show that genomic testing is very much the future, because all of us, we're all 99% the same when it comes to our DNA. And only 1% codes for all of the amazing individual things that make us all unique. So in that 1%, we're looking at some very specific genes to look at things such as hormonal changes, stress, vitamin deficiencies, things which are impacting on your specific hair loss problem. And so again, this is just to remind us of what we might be able to use, but also to remind us that each of these pharmaceutical ingredients has not just its own benefits, but it has side effects as well. So if we can provide you with a tailor-made program that's really unique to you, we avoid you needing to take some of these estimated things that I would hope would work for you. And thereby we avoid the side effects of them as well. And there's obviously a cost implication to giving you a broad, generalized, generic treatment plan. Instead, we give you a tailor-made plan, which might just be 2 or 3 ingredients, and that's much more targeted to you. So again, the test looks at various factors which are relevant for your specific type of hair loss, such as hormones, prostaglandins, which are like fat messengers on the scalp, vitamin metabolism, all sorts. And this is some of the genes looked at. And this is just an example of that particular enzyme called 5-alpha reductase. That's very important for converting testosterone to DHT or dihydrotestosterone. If you have the abnormal or the slightly less, the non-beneficial form of the gene that codes for 5-alpha reductase, we know then to either recommend you dutasteride or finasteride. So this is just the workings of how this test would be implemented. And just a summary of how we take the swab and then arrive at our final treatment plan. So that was our Tricho test. Now we're on to some very non-invasive regenerative treatments, which we're really proud to be working with. So the HR3 cap is a home device that not just treats alopecia, but it prevents it in the future as well. It's completely painless. Sarah's going to demonstrate it at the end. It's something that you use every day, but it's completely painless. The whole family can use it. It utilizes this amazing technology, which is known as low-level laser therapy. And there's been a wealth of studies to support its use. This cap in particular is unique because it has 246 diodes, which emit laser energy at a very specific wavelength associated with regeneration, and also these little diodes pulse at a specialized frequency known as the frequency of Nogier, and this stimulates hair growth and regeneration. It's ideal for all forms of hair loss, even some of the very difficult to treat hair loss that we used to say, I'm sorry, sir, this won't, our normal treatments would not work for you. The studies that have been generated from this cap have shown some really remarkable results. And also, we use it in combination with some of the other treatments like finasteride, dutasteride, or minoxidil, as well as PRP, to enhance those results even further. Another important thing about this cap is that it's completely customizable. So depending on where your type of hair loss is on the Hamilton-Norwood scale, you can adjust the length of the treatment depending on the severity of your hair loss. And that has led to some really important changes in the studies, which show very targeted hair treatment as well, even with this device. So we generally recommend that you have some in-clinic treatment, some home treatment, and then that is augmented by using the cap on a daily basis. The company that produces the cap has also produced various supplements and shampoos, and the supplements contain some of the natural remedies which we talked about earlier as well. So it's just a very good all-round way of managing hair loss. So that's Hairox, which is the supplement I'm taking every day. It's got plenty of vitamins which support hair growth, as well as some of the herbal remedies which block the creation of dihydrotestosterone. As I said, there's been plenty of studies about low-level laser light therapy, and there's been around 11 specifically for this type of energy that's used in our cap. And they have been very, very reassuring in terms of regenerating hair. You can look as many studies as you like, but sometimes it's the pictures of clinical improvement that are most exciting, particularly for me. The next slide I'm going to show you has been achieved, the results have been achieved in only 3 months. As you can see, this is quite impressive. The other slides are going to show results that have taken a bit longer, nevertheless very, very exciting, but I think this one is really, really remarkable. So even hormonal hair loss there, female pattern hair loss where the anterior scalp is thinning, quite advanced male pattern hair loss there, and an improvement even in early hair loss as well. So that's our cap, and if you get the cap through us, you get 3 months of the supplements as well included, which isn't something you can get if you buy the cap directly from the company. We also have a unique treatment called Angel PRP. Now, some of you may know about PRP, you may have had it for your skin. The difference with Angel PRP is this is a much more complicated method and much more advanced method of isolating those amazing growth factors which put the hair into the growth phase. Somewhere way back, we were talking about certain things which make the hair go into the growth phase, which are IGF-1 and PGE2. The beauty of this machine is that it does take quite a lot of time to produce the growth factors, but this machine has been identified to produce the highest level of these very important growth factors for hair growth. Like all PRP, it isolates platelets, which are these little blood cells, platelets, and they are nature's powerhouse in terms of regeneration. So what they do, the platelets are isolated from blood. They are then re-injected back into your scalp, where they release all these wonderful growth factors. And the amazing thing about this machine is that it actually produces a concentration of growth factors, which is most beneficial for hair growth. And this is just some of the geeky, nerdy science about how our particular machine is different to others. It actually puts the blood through 2 spins. it's very, very exciting to watch the growth factors being separated, and it's much more advanced than any other machine I've used. And the results from it are much more advanced than any other PRP machine I've used as well. More geeky stuff. We're almost at the end. I'm really grateful you guys have hung on. This is another clinical slide where the results have been really astounding and really quite surprising, because most PRP treatments will take at least several months before you see an improvement. This particular result, and this is by no means normal, this is really impressive. This regrowth happened in 10 days. And I know this patient went on to have more treatments. Just a study to show what I was talking about earlier, where PRP isolated from our machine, the Angel PRP machine, makes much higher growth factors, which are important for hair growth. And this is one of their other studies, which I believe took a bit longer. This patient had two treatments, and you can see that his male pattern hair loss is almost reversed, just even with 2 treatments. It's that good. Obviously, we have to say that individual results are different, and it's often dependent on your genetic makeup, which is why we do want to look at your tricho test as well before we even think about doing treatments like this. Additionally, we do a lot of injectables in our clinic, and we also offer hair mesotherapy. Now, this is something slightly different to growth factors. These will contain sometimes plant growth factors, as well as concentrated vitamins, which are injected directly into the hair bulbs, or the skin supporting the hair bulbs. And if you think about your diet, you might be having the best diet, you might be supplementing with fantastic nutrients, but once the circulation has taken the blood to the scalp, the quality or the concentration of nutrients present for the scalp circulation might not be so good. So therefore, we do these regular treatments with hair vitamins injected directly into the scalp, and we get some really impressive results with that too, especially if you combine it with PRP. We are actually at the end of this long talk. I'm really impressed any of you stayed for the whole length. We have got lots of ways to keep in touch with the lovely clinic. This is our channel on YouTube, where we've got lots of engagement. We regularly discuss the latest developments in science and treatments for aesthetics, and obviously integrative health and hormones as well. So we've got lots of videos on related topics to what we've been talking about today, as it applies to hormonal balancing and personalized prescription medicine, not just for your hair, but for your skin and for your general health as well. We are really passionate about this personalized approach of combining the internal and external to help our patients look and feel their best. And the message is getting out there. We have another article coming out in the not too distant future in the national press. So if this internal external approach sounds like something that might be a good fit for you, the first stage would be to call our team, who will guide you through booking a consultation, whether it's a hair consultation with tricho test, or a comprehensive bioidentical hormone consultation, or indeed any other treatment that we offer at the lovely clinic. And our team, as I said before, they are absolute experts in what we do. They will walk you through everything from booking the first appointment to any other questions like timings, fees, or advanced level details of what we offer. So our coordinator team is definitely on standby 7 days a week. Thank you very much for listening. We're just going to ask Sarah to show, because we did talk about the cap.
Hi.
Hey, are you still alive after all that?
Yeah, I am. Thank you.
So we talked about you and your own, we've obviously done a lot of learning about hormones ourselves. What did you think about sort of your journey with hormones? Because obviously you saw Dr. Hertog first, and then we took over things as well. What do you think about that?
Yeah, well, I mean, that's a pretty broad question, so expect a broad answer. It's good. Oh no, seriously, beforehand, I mean, you've seen the pictures. I was overweight, very puffy in the face, tired all the time, couldn't get up in the mornings, have to snooze my alarm, you know, like 3-4 times at least just to get out of bed. And it didn't happen straight away. It probably took about 6 to 12 months in total for it to work. But yeah, I lost a lot of weight, much more energy in the gym, feeling good. So it makes me kind of sad to think that there are people who feel like, oh, this is just part of natural aging. This is normal for me to feel like this because, you know, I'm 40 next year, and I gotta say, I feel the best that I felt in years, years. Really good. Not to brag.
Oh, that's great news, Sarah. What about because we did everything for you, didn't we? We did the whole
Yeah.
sort of level of testing, and also we did some other sort of quite out there investigations as well. Yeah, I mean that was an awful lot of content that we squished into an hour and a half. If there are any specific questions that have come up, please do just unmute yourselves or raise your hand, and then we can try and answer you as best as we can.
You did have some questions actually. So one of them was, have you used any of these treatments personally, and what did you think worked best for you?
For me, okay, so I really like the sort of integrative approach. So I quite like the natural approach wherever I can. So I'll do things like exercise, intermittent fasting, certain dietary modifications, just to manage some of my own health problems. Like I've got autoimmune condition, and also I was packing on a little bit of weight on my midsection as well. So I used one of our supplements that we provide for patients who we don't want to give them testosterone, because it can suppress your own testosterone production. So for myself, I went on a supplement which contains many of those natural herbal supplements that naturally increases testosterone.
Give us a name.
So that one is called Libido Stim, and that's made by Designs for Health. And I also tried, I had an issue with low testosterone. I also tried clomiphene as well. So I tried, it's a fertility drug, and I took a very, very low dose of that, and my testosterone levels went a little bit too high actually. So yeah, I was quite impressed with that.
Somebody's just asking about collagen drinks. I think that they mean in the context of hair loss. Do you have any comments about that?
Right, you know what, I'd have to check the answer for that if I'm honest. But what I have seen is that if we're doing a sort of a controlled trauma to the skin, for example, with something like microneedling, and when we do injections on the scalp, we're signaling the body's own repair mechanisms to regenerate. So if you're taking collagen drinks at that time, and for weeks after that during the regeneration process, I think the results will be a lot better.
And somebody else is just asking about perimenopause actually, and when you should start looking at, I guess, having hormonal support.
So perimenopause is a really interesting time, and if you catch any hormonal imbalance early, the huge benefit is that you coast very gently into menopause without the typical features of aging, such as bone loss, mental decline, cognitive decline, and skin and hair loss as well, because these are hallmarks of aging, but also of menopause as well. Because as soon as you get this dramatic decline in progesterone first in perimenopause, and then estrogen, that almost opens the door to hair loss, to skin wrinkles, and to sagging in the face, and also general body aging, such as even heart disease as well. So if you start, my feeling is with most things in medicine, prevention is better than cure. So if you know you're in perimenopause, if there's certain signs that you're experiencing of perimenopause, it's a great time to come and have a hormonal MOT. And that way we can really start the process and safeguard against the typical features of menopause happening. Not really. If I'm going to be brutally honest, not really. There are certain contraindications, such as active cancer or cancer within a certain year, within a certain amount of time. But I have, much older ladies, much older men who I will start on certain types of hormone therapies. Not necessarily the same as I would for a woman or a man in their 40s or 50s, but certainly some sort of hormonal support. I think if you've got, we've got a tool now, which is body identical. It's exactly the same as what our bodies produce in health and youth. And if we're recognizing these things happening as a part of aging, why can't we try to do our best to mitigate some of those problems before they start? Because the alternative is that you get osteoporosis, you break your hip, And unfortunately, we're seeing it much more in men now as well, because as we get older, we're seeing osteoporosis in men. And actually, if you get a hip fracture as an 80-year-old man, it's much more lethal than having a heart attack, because the frailty that accompanies all of that osteoporosis means that you won't survive. You know, survival and prognosis after that are not good. So I want to keep your bones strong, your heart strong, your mind strong, everything strong, quite frankly. I think we have a dentist on board today as well. And it's a very well-known thing that, you know, lack of estrogen progesterone prevents, optimized estrogen and progesterone prevents some of those periodontal changes that you see that cause tooth loss as well.
I don't think I have any more questions here.
I mean, I think these guys have been amazing. Thank you so much for being here today. If there's no more questions, I'm going to wish you a very happy 2021. I hope we see you in the clinic at some point as well. Keep in touch, and thank you so much for spending this rather long time with us today.